some breaking news. The Chief Medical Officer has confirmed the death of a child from Strep A. Professor Breda Smith was speaking to Virgin Media News in the last few minutes. Our news correspondent Zara King joins us now. Zara, what can you tell us about this breaking story?
Yes, Colette, so obviously this is devastating news for this child's family. This news is just breaking in the last couple of moments. A death in relation to what's described as invasive group A streptococcal. So it's a very specific, extreme version of this infection. We know the child is living in the east of the country and is under the age of 10. We can take a listen to what Professor Breda Smith has said literally in the last few moments.
Well, unfortunately, I can confirm that there has been one invasive group A strep associated death here in Ireland in a child. And this is a very sad event. So I would like to extend my deepest sympathy to the family of the bereaved. As you know, I don't comment on individual cases, but with regards to group A strep, I think it's important that there will be a lot of anxiety. So it's important for parents to know that the majority of cases of group A strep are mild infections and can be treated with antibiotics.
Well, Colette, look, obviously there will be parents watching the news at lunchtime who will be upset and concerned about this. We want to speak to a consultant paediatrician, Dr. Niamh Lynch, who's based in Cork, and she's saying, look, for people not to be totally alarmed by this, obviously this is very upsetting for the particular family at the centre of this case, but she's saying that in most and in the majority of instances, streptococcal can be treated with antibiotics.
Well, people are just mixing more than they have for the last 2 years. And the way that group A strep is spread is through droplets, coughs and sneezes, and from surfaces. So if you think about a creche situation where a child will put something into their mouth, put it down, and then another child might pick it up. So hand hygiene is very important. If your child is sick, you probably shouldn't send them to creche because they may have something that they're going to spread around. So it's really because there's more mixing, but still the numbers of group A strep are lower this year than they were pre-pandemic. So it's not back up to what we would have considered normal levels in the past just yet.
So, Colette, look, overall, I suppose Niamh Lynch has been very clear in saying there's no need to mass panic on this. But if you are noticing differences, she says parents know their children better than anyone. If you're noticing major differences, particularly if your child is lethargic in any particular way, then of course to consult your doctor. But that breaking news is lunchtime, sadly reporting that one child under the age of 10 has died from invasive streptococcal strain A.